Let's face it, everybody ages and nobody youngs. Every single person is going to enter the stage of older adulthood.
1 in 5 persons will be over the age of 65 between the years 2010 and 2030. So it's a fast-growing population. In fact, the fastest is those who are 85 years and older.
The seniors today are much more active, and they are approaching their own aging, kicking and screaming and resisting.
A lot of times when we think of seniors, we think of them as being elderly and incapacitated, not being able to do things for themselves. But the more I interact with seniors now, that's not the case at all.
When they say 60 is the new 30, they actually mean it. People are much more vivacious, much more engaged, much more involved in not only their own health, but in keeping healthy.
You're seeing folks that are living much, much longer than they historically had. Also, we're seeing people living better, so that they're much more functionally capable in many cases.
And even the seniors we meet in the nursing homes or the assisted care facilities, they want to be active or engaged in the hobbies that they've had all their lives. They don't want to be homebound or room-bound. They want to continue on with as normal of life as they can.
Okay. Geriatric nursing is the practice of the future. We know what the demographic statistics are telling us.
The face of geriatric nursing is probably like the face of nursing in general. I think it would span, across genders.
Society at large has changed where for a man to be kind of that compassionate, caring person is a little more acceptable, which I think has helped the male nurse population.
People who want to really affect the lives of individuals will like geriatric nursing, because you have an opportunity to work with individuals and their families. You have an opportunity to work with people over time.
Nurses who work in maybe a critical care or emergency room, I would say you kind of get that instantaneous kind of temporary rewarding kind of feeling, because typically it's a very short-lived interaction with the patient, where in a geriatric setting you tend to build a much longer relationship with them.
A geriatric nurse addresses the whole needs of the elderly client. They address not only the physical needs they might have, current diseases, looking at their medications.
It's also a nurse who moves seamlessly from taking care of an individual to taking care of a group to managing a community to involving family to working on health policy.
But then looks at an overall plan of care mentally, physically, spiritually, and emotionally. I think you have to have a place in your heart that accepts older people for what they are.
The challenge for us as healthcare providers, as nurses, is to help them live well. That's what nurses are uniquely qualified to do, and that's what we do very, very well.
One of the primary issues facing nursing is a shortage of nurses at the bedside.
As we continue to project into the future where more and more nurses who are of the baby boomer population are going to retire, that nursing shortage potentially will get larger, and eventually it'll start to affect the quality of care.
And right now, the student population isn't there to take our places.
I believe that with the right training, anyone can become a geriatric nurse.
From a job perspective, opportunities are limitless. There are jobs probably being developed right now that we are not even aware of because of the plethora of people aging.
Because it's such a rewarding area of practice, we find many people will go into that area and stay in that area.
Nursing has the greatest portability of almost any profession you could find, regardless of where you work, where you move, what transitions you make in your career. The opportunities are almost endless.
If anything, one has the challenge of deciding which position one would like with everybody recruiting you.
Not too bad. What's going on today? I went into nursing 6 years ago, and I always wanted to work with babies. I thought that they were adorable and cute, and I loved little kids.
Younger students do sometimes gravitate to mother and baby kinds of care because they think it's a very joyful situation, but there can be an equal excitement at the end of life as well.
With older adults, you get to see all their wisdom, you get to see all their life experiences, and that is, not something you could ever put words to necessarily.
I learn more from them in regards to patience, humor, outlook on life than I would ever learn, and I consider it a privilege to care for my older adult clients.
There's so much more that goes now into the education and what nurses are doing. We have to be as knowledgeable to a certain degree as a physician to see when problems occur, when a patient is starting to have more difficulties, where their condition worsens.
What a bachelor's degree does is it gives nurses very important detailed knowledge about pharmacology and about clinical conditions and about functional nursing care. And it gives them the tools to be able to go out and care for patients with those conditions.
As far back as 1975, when I graduated with my diploma program, I applied to Massachusetts General and was not hired there because I didn't have my bachelor's. I think based on my experience, my diploma was very useful and very valuable, but it wasn't going to take me anywhere without the bachelor's degree.
Your associate degree program in nursing has given you adequate clinical experience to come back into a bachelor's degree program almost immediately. The requirements for your associate degree were strict enough that you have the clinical background that you need. Don't hesitate.
If you're in that place right now, I can only tell you that it's really important to keep on going.
There's an entire other science out there, the science of nursing. And I think that nursing is trying to differentiate itself right now, and I really feel that by obtaining my degree, that I can make people look at the nurse not just as someone who gives you a medication in the hospital or puts a Band-Aid on you, but someone who really knows you and someone who can answer those questions. And one of the only ways that you can accomplish that goal is by continuing your education.
You have to think of nursing as a career, as a passion. And if you go into every day recognizing your passion for nursing, you'll always be a good nurse. And you'll always be the kind of nurse that we as a profession can be proud of.